Hi, my name is Ebony, and my pathological disease that I chose was psoriasis. And it may have been just out of curiosity because I wanted to know. Because I have a lot of patients. I work at a hospital, I'm a phlebotomist. So I have a lot of patients that I see that have psoriasis, and I'm just like, I guess it's like something like everybody just get eczema. I guess psoriasis is another thing that you can get as a skin condition. But that's why I chose it. So, psoriasis is a complex and chronic multifactorial disease that involves the growth of keratinocytes in the skin. Various factors such as genetics, environmental factors, and the immune system play a big role in how people get psoriasis. The development of this disease, although it's not contagious, it can cause some symptoms to appear or worsen. Psoriasis triggers can be as simple as stress, an injury to the skin. You may even have like an allergic reaction, and next thing you know, you have a whole flare up of psoriasis. And I know some people that have triggers with stress, psoriasis, they have often tend to maybe do like some yoga or relaxation techniques, stress management. And people with stress psoriasis, it may seem like an endless loop because I mean, as human beings, every day is not peaches and cream. We may have get stressed every day, and the next thing you know, you have a psoriasis flare up. So I'm pretty sure people that have psoriasis and that triggers their stress is kind of hard to manage, you know. And as far as like an injury to the skin, psoriasis can appear on areas of the skin that have been injured or harmed, such as scratching, because I know psoriasis can itch, so it may just be human nature to just scratch it, thinking you trying to like kill the itch, but if anything, that's making it worse, you know. And sunburns, bug bites, vaccinations can also trigger a psoriasis flare-up. Being again, this is like an immune system. Your immune system is being affected by various conditions of bronchitis, tonsillitis, an ear infection may cause a flare-up of psoriasis. So I feel like people with psoriasis have to live a very strict day-to-day life so that they don't cause any more flare-ups, you know. So that was very interesting to know. I didn't know you can get psoriasis from stress, but I'm lucky I don't have it. So some signs and symptoms of psoriasis can be a sudden onset of a small areas of scaly redness, some throat infections, viral infections, any infection that may pop up, you might have psoriasis. I'm just playing. But if you have known issues of that, then it might be okay to go see a doctor to see what's going on. And also pain in like your joints that may be new for you, like arthritis, then you might need to check out that. People that have a high fever may be signs and symptoms of psoriasis, then you might need to check on that as well. But then again, it might be like a common cold, so then maybe not. And common types of psoriasis are chronic stationary psoriasis, can be involves the scalp, the umbilicus, and the retroarticular regions. Plaque psoriasis most commonly affects the extensor surfaces on the knees, elbows, scalp, and trunk. And I see a lot of people that come in the hospital. I see a lot that have psoriasis like on their hand, and it's like really scaly and hard. So just to be aware, if I had a picture, I would have put it in here. Also, I know a lot of people that have scalp psoriasis. That's another big thing. I think that's common to a lot of people. Like 50% of America has scalp psoriasis, and it's worse than dandruff because it's very flaky, you know. So you have to make sure you moisturize it a lot and it get irritated a lot. Also, let's get into the medications that can be used to kind of help the psoriasis. As far as topical medications that you put on your skin, there's a lot of those. Then you have some medication that you ingest that can help with, you know, calming the psoriasis down, like TNF inhibitors and topical retinoids. I think you have to take a certain percentage in order to calm the psoriasis down. And that's it for my psoriasis pathological disease presentation. Thank you for tuning in, and I hope y'all all enjoyed it.